So I'm talking today about testosterone. Obviously it's pretty important. If you're looking at this video, you're probably seeing some issues with either your mood, your libido, your sex life, possibly even memory or like what's going on with your metabolism. And a lot of times, you'll see strength or endurance changes. So you kind of want to go, okay, well, what's going on now? And is it just my testosterone? I'm kind of a straws on the camel's back kind of guy. So we tend to want to look at a little more than that. But testosterone is a big player. So we want to kind of consider that in the big picture. There's lots of choices out there and lots of what you're hearing out there. We're here just to be a guide and actually a one-on-one guide as far as avoiding the mill that are out there, the mill kind of milling you through. Here's your testosterone, move you on your way, and not really give you a personalized approach, which is necessary because hormones are very complex. Hormones interplay with other hormones and other aspects of your physiology. If you're ignoring that, maybe you'll get some short-term gains, but long-term, it's not a good play. So, 1 in 50 men have low T. It starts at about age 30. You start to see some decline. Insurance companies, they say, okay, yeah, we're ready to treat you when you get down below 300, which is ridiculously low. You'll start to see changes in libido, in your sex life, in muscle endurance and strength gains and all of that well before you start getting down into the 300 range. So, we want to kind of keep it personalized and focus on you as a full human being instead of just your number. But that's standard with the labs right now. So we want to kind of look at the areas that need support. We want to look at the whole picture. We want to look at all the foundation and building blocks, looking at your dihydroepiandrosterone, kind of those precursors, looking at your cholesterol levels. Your sex hormones are actually produced from your cholesterol levels. So we want to look at this whole picture and see the foundation, see the structure, and see how they all interplay. So there's some supplements, and there's a lot out there, a lot of information out there. I still just say be a little cautious with that because too much of a good thing is a problem. A lot of evidence of too much testosterone actually producing ED, and that's the last thing we need. So look at this as maybe some information, but again, I would probably not go down this road without some lab testing or to see where you're at in the first place, because maybe the problem isn't your testosterone levels. Maybe it's something else like your insulin or even estrogen and your aromatizing. And I'll talk about that here in a second. But Tongat Ali, kind of the new craze out there. Dr. Huberman's talking about it. It's been shown to increase your testosterone levels. Deer antler velvet basically can be shown to increase your testosterone levels. And then chrysin actually prevents aromatization. And basically aromatization is you're changing your testosterone into estrogens. We're having too much of this push towards the estrogenic pathway. Chrysin can actually help with that. Rhodiola, there's talk about how it helps your testosterone levels, but it's more of energy. And so again, more energy and your improved ability to exercise. The exercise is actually what will boost your testosterone, in my view, instead of the rhodiola. So exercise works really well, and getting the weight off works really well as far as helping your testosterone levels. So again, we want to look at the whole picture and see what's in play with you. So injectable testosterone is another option that we'll use. It's very easy to adjust dosing. We always do it with lab testing to maintain those satisfactory levels. Sometimes it's covered by insurance, but again, you got to be pretty darn low for them to be, considering paying for that. So other options are pellets, kind of a slow release option. Harder to maintain those levels, harder to keep a balance because of the way you will metabolize what's inserted. Peptides are another option, helps with weight loss, and again, that exercise portion gets you more energy, gets you moving, and again, it gets that testosterone built up. So it just comes down to personalized conversations. We want to sit down with you and figure out what's exactly right for you. You will sit down with a provider instead of being milled through and just having staff give you your injections and send you on your way and not really even consider what's going on with your symptomatic complaints as well as objective or lab type findings that we're having there. So it's not just a simple too high or too low. All right, so personalized options just to get you back on your feet again, get you moving and shaking and get you where you feel like you should be. So once the treatment plan's set, you've sat down one of our providers, medical providers, figured out a plan. We have same-day appointments available. They're quick in and out. Again, still sitting down with the provider and give you the time that you need. But if you're a busy, have a busy life like the most of us, we're not going to take up too much of your time. Your time is so valuable. So we'll just make those adjustments and we'll tweak it and discuss that with you and get you back on your feet, get you back on your road. We're Attain Health Omaha. Our phone number there, 402-505-3210. And a good way to get a hold of us is attainhealthomaha@gmail.com. Give us a holler if you want to sit down with one of our providers and see if what we have to offer is something that would be useful for you. Take care.